Hi, welcome to part 2, chapter 23, and we're going to start with chronic diseases. You can see here chronic diseases in America. 6 in 10 adults in the U.S. have a chronic disease. 4 in 10 adults in the U.S. have 2 or more chronic diseases. Chronic diseases are the leading cause of death and disability and leading drivers in the nation's $4.1 trillion in annual healthcare costs. Chronic disease include all of the above. The most common chronic disease in America and the most common cause of death in America, regardless if it's man or woman, black or white, is heart disease. The second chronic disease is the second most common cause of death in the United States for adults is cancer. The third most common chronic disease causing deaths for American is chronic lung disease, COPD. And the fourth most common chronic disease causing death in Americans is stroke, followed by Alzheimer's, diabetes, and chronic kidney disease. So, chronic diseases in the United States prevalence, they're widespread. The CDC estimates about 6 in 10 adults in the United States has at least one chronic disease, and 4 in 10 have 2 or more, just like the picture showed. Leading causes of death and disability in the United States: number 1, heart disease; number 2, cancer. Causes of death, both in which are chronic conditions. The economic impact: chronic diseases place a significant economic burden on the healthcare systems and individuals. They account for a substantial portion of healthcare spending, and people with chronic diseases often incurred higher medical costs. Risk factors: many chronic diseases are associated with modifiable risk factors, such as poor diet, physical inactivity, smoking, excessive alcohol consumption. Addressing these risk factors was a public health priority for reducing the burden of chronic diseases. So continuing with health promotion and disease prevention, there's 3 principles of health promotion and disease prevention. Number 1, health risk appraisal, determining what are the risk factors and what are the consequences of those risk factors. 2, interventions for counteracting the key risk factors. And these interventions include 2 approaches, which are right here. Number 1, behavior intervention. Consider individual level factors in conjunction with broader social and environmental contexts. Basically, behavioral intervention, adopting healthier lifestyles. Okay, interventions to counteract these risk factors. Behavior, change your behavior, change modifiable risk factors. Number 2, therapeutic intervention, primary, secondary, and tertiary. Adequate public health and social services would be the third. 1, 2, 3. Adequate public health and social services to minimize risk factors and to minimize negative effects. We need to have adequate public health and adequate social services. So let's come here to the 3 main categories of disease prevention. You've probably learned this before, but certainly something you'll see on your certification exam. Primary, secondary, and tertiary. Primary, just preventing, P for preventing the development of the disease, like smoking cessation. The patient that is smoking, and you get that information from your history, you're going to be required to write smoking cessation encouraged, just in order to comply with primary prevention strategies to decrease risk factors and modify risk factors for disease prevention. Exercise programs, prenatal care, even something social services, even some environmental like protection of our water supply. So those are all preventative. Number 2, secondary, early detection and treatment, health screenings, physical exams, screening for blood sugars, mammograms, screening for hypertension, and then tertiary interventions that can prevent complications from a chronic disease. So now they have the chronic disease, and these are going to be interventions that can interfere or prevent further complications from the disease from occurring, like rehab would be a perfect example of this. Infectious disease would be an example of that. So those are important to know. So disease prevention under the Affordable Care Act. So Prevention and Public Health Fund, and this is on in your book on page 680. And I'm just going to say a couple things about this. So there's specific Affordable Care Act initiatives that are included in this Prevention and Public Health Fund for national preventative efforts and programs geared toward improving health outcomes and enhancing quality of health care. So the Office of Surgeon General developed a national prevention strategy to encourage partnerships among federal, state, tribe, local, territorial governments, businesses, industries, other private sector industries, philanthropic organizations, community, faith-based organizations like churches, and everyday Americans to provide health through prevention. As one example of the federally driven effort directed toward reducing chronic diseases, the CDC established this National Diabetes Prevention Program. In 2012, 6 organizations received over $6 million to develop partnerships with the aim of reaching people with prediabetes and prevention of getting diabetes. So these people were offered prevention lifestyle programs in healthcare clinics, pharmacies, wellness centers, work sites, community centers. They increased awareness of lifestyle changes. They encouraged health professionals to refer patients with prediabetes to lifestyle change programs, and just increasing awareness altogether. Funding to establish and evaluate comprehensive workplace wellness programs. In 2011, $10 million in federal funding was available to establish and evaluate comprehensive workplace wellness programs. Beginning in 2014, $200 million in wellness grants was made available to small businesses to encourage the establishment of wellness programs and employee health promotion incentives. In 2015, 46.8 million employees worked in firms that offered wellness programs. These programs are diverse and they vary in services and activity, but they're all required to promote health and or prevent disease to qualify for this federal funding support. Of the companies that received the funding and provided health benefits, 50% offered wellness programs for tobacco cessation, weight control, nutrition, other lifestyle behavioral coaching. There were health promotion activities on site, such as vaccination services, biometric screening, fitness benefits, health food options at the workplace were also common. They offered screening programs, intervention services. These federal funding, this money used to establish these workplace programs have shown to generate savings in medical costs for up to $3 for every $1 spent on the program, and to reduce absenteeism in the workplace. As of 2017, almost half of all U.S. work sites offered some type of health promotion and wellness program and received this funding. These are the leading causes of death. In 2017 was this was done, but this still holds true currently. Environmental health and public health both are very instrumental in reducing the risk of of infectious disease. So for example, if we would have made this list in 1900, pneumonia, tuberculosis, and diarrhea would have been the top 3 killers in the United States, and that's no longer the case today because infectious disease has just come a long way, and environmental health, public health programs, social programs have played a huge role in reducing these risks of pneumonias and tuberculosis and diarrhea infections from food and water sources. So the leading cause today, so all causes of death, 100% of the deaths, so out of 2.8 million deaths, number 1, disease of the heart. So heart disease, coronary artery disease, 647,000 people died of that. Number 2, the second most common cause of death, malignant neoplasm or cancer, almost 600,000 people out of 2.8 million died from that. Unintentional injuries is the third most common cause of death in adults in America, but it's the only one here that this one, we're talking about the top 4 here. This is actually not a chronic disease, but it is the number 4 leading cause of death in America. But here, the next one, which is the third most common chronic disease causing death, but here, 1, 2, 3, 4, fourth on the list is chronic respiratory diseases, most basically COPD. The next is cerebrovascular disease or stroke, 146,000. So chronic diseases, number 1, heart disease, number 2, cancer, number 3, respiratory disease, COPD, and number 4, stroke. Those are important to know. And it progresses on to the next being Alzheimer's disease, chronic disease, diabetes, mellitus, chronic disease, influenza, pneumonia is next, but that's not chronic disease. And then some nephrotic syndrome, nephrosis, nephritis, and suicide being the last, but it made the list of the top leading causes of death in America. This next thing is a picture of, actually I thought I had a picture on here, of what we call Bloom's model of health determinants, and it's a framework, and it defines 4 areas or forces that contribute to health and well-being. So these 4 things contribute to somebody's overall or determinants of their health. Number 1, actually being identified as the most important force, is environment, including water, air pollution, food, toxins, safety, waste, overcrowdedness, etc., etc. So that plays a huge role and the most important role in contributing to the determinants of health. Number 2, and the second most important, is lifestyle, or what we've been talking about, behavioral risk factors, which include how their lifestyle, somebody's lifestyle factors relate to health. So study shows that diet plays a major role in most of today's significant health issues. I covered that already in the first part. As far as coronary artery disease and diabetes and cancer and stroke have a direct link to dietary choices. And cigarette smoking has a direct link to lung disease and lung cancer. Number 3, the third most important, is hereditary or genetic factors. There are genetic factors that predispose people to certain diseases, and that is just non-modifiable. And the last one that is the least, but it still remains a factor. And research suggests that the availability of primary care significantly correlates with reduced mortality. So people who have regular health care. And this is typically related to socioeconomic status. People with a low socioeconomic status often cannot afford to go to their primary care to get primary care, basic care, screenings, lab work, physicals, that type of stuff. Okay, these are just some terminology titled up here, measures related to health. So measures of physical health, how do we measure that or determine that? First, you should understand the difference between morbidity and mortality. And morbidity and mortality are truly closely linked, and you often will see them in the same comment or the same sentence. And morbidity is the disease or the disability or the state of being unhealthy for a particular disease. So morbidity is basically like how many people have this disease? What is the percentage per 100,000 people who have coronary artery disease, or any who have mental health issue like depression or has hypertension? So the state of being unhealthy, or how many people per 100,000 has it. Mortality is the death rate. So obviously mortality is, speaking of death, so that's a little easy to remember. It's the death rates, and what is the number of deaths that occur in a population of 100,000 people. How many people have that disease, and then how many deaths are there related to that disease. And that's the difference between morbidity and mortality. The next one is longevity, and basically we measure physical health by longevity, and it's just life expectancy, and typically it's about 80 years old now as far as the life expectancy in America. The next one is disability, and disability is a disease or injury, and we need to be able to measure this disease or injury that person has, and it's measured by their activities of daily living. So they have to be determined that there is a deficit within their activities of daily living that defines if they have a disability or not. And ADLs, our activities of daily living, or ADLs, include things like feeding, bathing, dressing, toileting, transferring, those types of things. Sometimes people have a physical disability, they have an amputated foot, or they have, they're so short of breath because of heart failure or COPD that they have a disability and they can't dress themselves, they can't shower themselves. The next is demographic changes. So demographic changes as far as another way to measure health. Number one is birth. This is pretty much just a birth rate, the number of live births per year. And migration is geographic movement of populations, and it involves like a permanent address change. So whether somebody's migrating from another country to our country, or somebody's migrating from one state to the other, demographic changes are also tracked to measure health and health in the community. The next one here is incidence and prevalence. And incidence is the frequency with which a disease or disorder appears in a particular population or area at a given time. The rate in which new cases occur during specific time period. So it's the frequency of diseases that are occurring. Whereas prevalence is the proportion of the population that's affected by a disease or a disorder. How many people in 100 people are affected by it? Okay, the proportion of the population, 50% of the population is affected by this disease. That's the prevalence. And this is how frequent the disease or the disorder occurs in a specific population, in a specific area, at a specific time. The incidence of influenza in school-age children in the north is this percent. This is the rate of it, and that would be incidence. So those are important to know the difference between. This last one here, we were just talking about life expectancy at birth in 2002, 7, and 15. It still holds true. So if we see here, in 2002, the life expectancy in the United States was 77 years old, men being 74 and females being 79.6. So females always have a longer lifespan than men because of testosterone, and men are physically more, they tend to exert more physical energy, and the testosterone plays a role in this. It's broken down into black and white. Still, women higher than men. In 2007, it went from 77 years old to 78.1, women still being greater than men. And in 2015, it went from 78.1 to 78.7. And now it's close to 80 years old. Again, females having more longevity or longer life expectancy than men. And this last thing I want to talk about is Healthy People 2020. Healthy People 2020 is something I kind of want to read to you. Oops, sorry, I wrote something down here. I wanted to, oh, here it is. Okay, so these Healthy People initiatives, since 1980, the United States has developed a series of 10-year plans, 2010, 1980, 1990, 2000, 2010, 2020, 2030, outlining certain key national health objectives. So objectives for national health to be accomplished during each of those 10-year periods. These objectives are developed by a consortium of national and state organizations under the leadership of the U.S. Surgeon General. The first of these programs, with objectives for 1990, provided national goals for reducing premature deaths among all age groups and for reducing the average number of days in illness among persons over age 65. A final review of this program concluded that positive changes in premature deaths had been achieved for all ages, except adolescents, but that illness among the elderly had not been reduced. However, this review set the stage to develop and modify the goals and objectives for a subsequent 10-year program. So Healthy People 2020 are objectives that the new objectives for 2020 that were identified. And there are three main goals that we wanted to have achieved by the year 2020. Number one, increase the span of healthy life for Americans. And that occurred, that lifespan has increased. Number two, reduce health disparities. Still working on this. And wasteful care. And number three, promote individual responsibility and accountability for one's health, as well as improved access to basic services. So improve their own individual responsibility for accountability and their ability to have access to some basic services. In broad sense, these services include medical care, preventative services, health promotion, social policy to improve education, lifestyle, employment, and housing. So according to the final review, the major accomplishments of Healthy People 2020 or 2000 surpassed the targets from reducing deaths and meeting their goals. This is Healthy People 2020 target areas. And you don't have to memorize this, obviously, but access to health services, arthritis, these are the topic areas that were addressed. Cancer, chronic kidney disease, diabetes, so some chronic diseases right here, education, nutrition, and weight status, substance abuse, tobacco, vision. So these are all topics. So now the Healthy People initiatives, which is the Healthy People 2030, has been in the works. And this vision for 2030 is to see a society in which all people can achieve their full potential for health and well-being across the lifespan. Its mission is to promote, strengthen, and evaluate the nation's effort to improve the health and well-being of American people. And this Healthy People 2030 is guided by 7 foundation principles. To attain healthy, thriving lives and well-being, free of preventable diseases, disability, injury, and premature death. Eliminate health disparities, achieve health equity, attain health literacy to improve the health and well-being of all. Create social, physical, and economic environments to promote attaining the full potential for health and well-being for all. Promote healthy development, healthy behaviors, and well-being across all life stages. Engage leadership, key constituents, and the public across multiple sectors to take action and design policies that improve the health and well-being of all. So this is 2020 going into 2030, and their long-term goal for Healthy People 2030. The mission and purpose of Healthy People 2030 is to achieve our nation's full potential for health and wellness. It promotes and increases safety, public health, and prevention. More work and continuous development ensure that Healthy People 2030 goals continue through the next decade. And we are going to be looking at that in the next module as well, but just kind of wanted to introduce to you what Healthy People 2030 is. It's certainly something that you will see on certification, so I want you to be introduced to it, and we'll continue